Good afternoon, everyone. Dr. Chukwubo Chukwumanandi, Amazing Grace Hospital and Fertility Clinic. Today is World Hypertension Day, and as as a means to celebrate the World Hypertension Day, I wanted us to discuss the issues surrounding hypertension and why it is important in our environment. First of all, let's start with defining the word hypertension. What is hypertension? In normal local parlance, it's called high blood pressure. What is high blood pressure? High blood pressure is a condition that arises as a result of elevation in the blood pressure of the patient, which is measured with the sphygmomanometer. When you measure your blood pressure, on a simple note, when you check your blood pressure and then it's adjused to be above 140 systolic and then 90 diastolic, you are expected to be informed that you have high blood pressure. Why is high blood pressure important? High blood pressure is important because it is a disease that is detrimental to the well-being of all of us, because it affects the four major organs that we need to be able to live a normal life. Number one is high blood pressure affects, when it is very, very high, it affects the heart. And then it can lead to myocardial infarction, which is heart attack. It also affects the brain. When it affects the brain, it is caused that the person has stroke. There's cerebrovascular accident, that's the person has stroke. If it affects the kidneys, you now give rise to kidney failure. And if it affects the eye, you now give rise to blindness. So these are the four major organs that high blood pressure affects. And that is why it is important that we take care of our blood pressure. When you have a blood pressure that is high, how do you measure it? How do you manage it? How do you know that you have a high blood pressure? I've mentioned that by checking your BP, and although blood pressure also can rise in children, but once your age approaches 40 years, it is expected of you to check your blood pressure regularly, especially in this environment with all the stresses and then modified lifestyle we live. It's expected that you start to check your blood pressure, and once you check it and it is above what I've just mentioned, you should be able to also know that you have elevation in blood pressure, and then you're expected to start doing things to eliminate it. Now, we know that high blood pressure can be as a result of familial causes. Maybe your father had it, your mother had it, your uncle had it, and then one or two people in the family are expected to have it also. Now, if you have that, it is called essential hypertension. That is familiar. Also, high blood pressure can be as a result of our lifestyle. That's maybe as a result of systemic diseases or other problems that affect the body system, gives rise to high blood pressure. And when you have this, what you are expected to do is to start addressing the issue. There are things you can do to also prevent high blood pressure. If you have a family history of hypertension, you are expected to start modifying your lifestyle. If you check your BP and it is normal, you are expected to start adjusting your lifestyle so that it will not predispose you to developing hypertension. Things like diet you take, dietary management. When we talk about diet, we talk about the things you take into your system, the food you eat, the drinks you take. All these things can affect your ability to develop hypertension. When you address these things, then there is a likelihood that it will delay the onset of high blood pressure or even make it non-existent in you. It may not even occur if you are able to control the lifestyle you live. Now, if you have also noticed that your blood pressure is high, now the next question becomes, how do you manage it? To manage somebody who has high blood pressure, it is a disease that is not something, it's not like malaria. When you take drug, it goes. When you have high blood pressure, it is there for you, it stays with you for life. One thing I tell people is that once you have high blood pressure, it's a chronic disease and it goes down to you to the grave. And then there's no amount of drug that you take that will make it to go away. Also, there's misconception about when you take drugs too much, the BP will crash. No. If you have high blood pressure and you're on normal prescribed medication, your BP cannot drop. This idea that when you take too much, when you take antihypertensive drug too much, then the thing will make your BP to go down. It doesn't exist, except you now take overdose. If you take your normal prescribed rations of the drugs that are prescribed for you, the BP will continue to remain normal. So the other things you do is to maintain your dietary management. Stop alcohol, stop cigarette smoking, control your intake of red meat and all the junk food you take. Those things will help you to control your blood pressure. Reduce your intake of too much oil. Then the last but not the least is that you must take your drugs. You can take your drugs on a daily basis. Some people take twice a day, some people take 3 times a day, depending on what controls your BP as prescribed by your doctor. Then lastly, as you take your blood pressure, as you take your medication, you should also know that as you take your medication, you continue to check your BP also. Because by taking your medication does not simply mean that everything is okay. You must continue to check your BP to make sure that it's within the normal range. Once you do all this, you'll be sure to avoid the chronic complications that arise with hypertension. Thank you very much.